Hey y'all, and welcome back to the latest episode of Code Brew. I'm Joe King, and you know what? Luke is still not here. Okay, I've got a new guest. Annie Phylaxis is with us today. You can say
Hey everybody.
Yeah.
Hi.
Luke is studying for a final in I think it's pathophysiology.
That's a tough one.
It is a tough one, so he's really stressed, and we wish him the best.
Yes. Good luck.
I need him to get through these classes because I'm stressed about his classes. Like, so I know he's stressed. I'm like, but he is back from the Philippines. I'm gonna let him tell y'all about the bird that flew into his face while he was on a scooter.
I heard the story the other night, and it's a good one. So
It's a great one.
To tell you all.
Not really sure what happened to the bird. I'm afraid somebody might have eaten it. I'm real sad about it. R.I.P. So he's back from the Philippines here in the United States. He did not get stuck out of the country.
Which is always good.
And he's so goofy that they didn't even check his passport when he was coming through customs. Like,
love it.
He's so goofy American. Like, he could not be anything else.
Like straight through.
They were like, "Oh, you're definitely American. This is where you belong. Come on."
Yeah. He was telling me that when he was going through, they asked him if he had any food, standard, and he was like, beef jerky, and they were just like, "You're good.
Just keep going."
Just keep walking.
He's
We
a
love
mess.
Luke.
We do.
He's the best.
We do. Okay. So yes, if you send all the positive vibes for Luke so that he can pass his finals, and I think I may keep him from taking any more classes because I'm tired of him stressing me out. I might be like, "Listen, you have to drop out. I'm sick of this." I actually have a final coming up too, so I'm definitely feeling it. But I'm more stressed about starting clinicals next month.
Yeah.
Trying to get everything lined up. I have some good sites lined up, so I'm pretty excited. Anyway, so Annie Phylaxis is here. She's a critical care nurse practitioner, and that's what we're going to be talking about, is like the transition to being an APRN after being a seasoned nurse for a while at the bedside. Before we do that, as always, I'm going to read the disclaimer really quick. The views and opinions expressed on Code Brew are solely our own and do not represent the views of our employers, professional organizations, or any personal or professional affiliates. This podcast is for educational and entertainment purposes only and should not be considered medical advice. Housekeeping out of the way. So yeah, you are a critical care NP.
Yes, my certification is adult gerontology acute care.
It's a mouthful.
It is. It's a lot of letters.
It is
ACNP.
They gave you 6 letters?
Mm-hmm.
They gave you 6 letters?
6.
They're only giving me 3
You're
letters.
going to have 3, yeah. F and P.
I'm getting half the number of letters.
And you're paying the same. You might be paying more since I've been in school for so long.
I'm paying equal tuition, and I'm only getting 3 letters instead of 6. I'm getting gypped.
Maybe. Yeah, definitely.
Can I speak to the manager? No. No, right. So, adult gerontological acute care nurse practitioner, right? That's a track that I considered whenever I was going back.
But you chose family because you want to do ER, right?
Right, yes. Yeah, family, because, when you work in the ER, especially like a rural ER, which is kind of, that's what I think I'm digging for the future.
Mm-hmm.
You have to be able to take care of the kids too.
Yeah.
So you have to have that peds experience, which I don't have a lot of. So,
That'll be new.
Right.
Sure.
That's actually where my first clinical is like pediatrics. So
exciting.
Hold on tight.
If you're into that kind of thing. I'm not, which is why I chose adult.
Yeah. I love kids. It's not that. It's just, I don't know if I love parents, but we'll see, right?
Yeah, no,
I think I have a lot to learn, for sure. But being a mom, I feel like I'm much more capable now that I'm a mom. I will say, because that kind of changed me a lot as a person and a nurse, so. Anyway, so what made you choose it? So you were like, hey, I don't want to take care of kids. What else?
So I've always worked in a critical care setting. I've always worked with adults.
You did a lot of ICU.
I did a lot of ICU. So my healthcare background started as a CNA in the surgical ICU. And then when I graduated with my BSN in 2010, it was just kind of like a natural progression. I just kind of filled in a role of the RN. It was just a step up, an advancement in the same unit. So it was just kind of, staying home, a natural progression.
Yeah.
And whenever I first started, they had a day shift and a night shift position open. And the manager was like, "Do you want days?" And I was like, "No," because everybody started on night shift, which I wish going back in time I could have told.
I know. I started on nights too.
Yeah. I wish I could have told little Annie Phylaxis to go with the day shift position, because night shift is so hard.
It is. It's hard on your body. It's hard on your mind. It's hard on your mental health. So, yeah, no, I did night shift for 9 years. And my parents were like, and other people in my family were like, we're not doing this. We collectively are not doing this anymore, you know? Because, I think I would like, it's not like I'm diagnosed, but like I'd be like sitting on the couch, hanging out, and then
Fall asleep.
Suddenly I'm napping.
Yeah.
You know?
So I think that whenever you work night shift all the time, you don't realize how you feel until you stop working night shift all the time.
Yeah.
And then you're like, whoa.
I'm such a more like a nicer, more balanced person.
Yeah.
I think, for sure.
When you worked nights, did you stay on a night shift schedule?
No, because you can't, because you want to have a social life.
Yeah, it's really tough. So whenever I first started working nights as a nurse at the bedside, I kept a night shift schedule. So I would be up all night, all the time. But fortunately, a lot of my friends were also night shifters. So I didn't really lose out on the social aspect so much. But I missed my family a lot because they're not up in the middle of the night.
Well, I did, like, because you kind of have to keep up with a night shift schedule. So you'd be hungry at 2 or 3 a.m. And that's how I developed my toxic relationship with Taco Bell. And boy, is it toxic, okay? Like, I love Taco Bell so much. Listen, I don't know if I should be proud of this or not, but I'm a Fire Rewards member.
Oh, I'm learning something new about you.
Yeah, it's not good. It's not good. Oh my gosh. It is. It's a very toxic relationship because you'd be hungry at 2 or 3 o'clock in the morning. Listen, down there in Mississippi where I was living, and then also like in Tennessee where I was living, I was still on night shift. There really wasn't anything open but Taco Bell.
Yeah, nothing's open that late.
And, I needed it.
You thought you did.
Well, it could be an addiction. I'm not sure. But no, anyways. So you chose, it seemed like a natural progression for you. Like, this is my home.
When I shadowed for the CNA job, I just followed the CNA that was there. I just followed her around for a shift, and I just really felt a spark in me. Like, it felt like I was where I needed to be. Cool. So it really felt like home. So then I worked there as a tech for 3 years. And then once I finished school, it was just, this is what I'm supposed to do.
I basically did the same thing, but with the ER.
Yeah.
I started as a ER tech, and then I transitioned to a nurse in the ER. And then, I stayed ER for most of my career. In fact, like, even if, like, my primary job was, like, not in the ER, I still had, like, a foot in the ER. Like, I had a PRN somewhere. And it just has always felt like home. I feel the same way, which is how I ended up choosing family. So I totally understand where you're coming from. You're just like, I gotta go home. I gotta stay home. So that's awesome.
When I interviewed for grad school, all 3 of the professors that I interviewed with really kind of drilled me about, are you sure you want to do acute care? There is family. Have you considered that? And all of them, I was just like, nope, haven't even considered it because that's not for me. And I know that. I'm aware of that. So it's not even worth me thinking about because I've always worked in critical care. So acute care is where I should go.
No, I think it's awesome. I've thought about, I might even do like a post-grad later in life. Or maybe I'll just stop with family. I don't know. But I've thought about it because it looks like y'all are having a fun time. Your job to me looks intellectually stimulating. While also, you have like a good number of skills, procedures that you get to do. And I love taking care of sick patients. So like to me, it looks like y'all are having a lot of fun.
Yeah.
Honestly. So tell me what a day in the life of an acute care NP really looks like.
So for my role specifically, like we do check out with the night shift team at 7. And then after that, it is chart checking and kind of pre-rounding, going around and seeing everybody, checking on vents and drips and with the nurses and asking them, you know, what they need and what they've assessed and priorities that they see for the day. And then we do like formal rounding with the interdisciplinary team.
What does that team look like?
We have a pharmacist, a dietitian, sometimes RT if they're not short-staffed and can participate with us, we'll be there.
I can see how that'd be important.
Yeah.
All those people are important.
And then sometimes the physical therapist will join us too.
Oh, cool, yeah.
And occasionally case managers too. So there are times when there are a lot of people, and it's really important for all of those different people to be there because everybody brings something different to the team and they're all experts in their area. So you know, there may be something that I didn't notice when I'm chart checking and the pharmacist did, and they'll bring it to my attention, or the dietitian says this patient hasn't eaten in several days or hasn't had a bowel movement. And so there are a lot of eyes, lots of eyes on the cases.
Eyes with different expertise and perspectives. So that's really cool.
Yeah. And it's vital to have all of those people there at the table on the same page, talking about each specific patient.
These patients are so sick. I mean, they're so complex. You know, we talk about, we use the term medically complex, but your patients, I mean, they're ICU level. So you can be medically complex and kind of be anywhere, but these patients are not just, it is not a simple situation by any means.
No, and it's not straightforward either. You know, you could have two people with the same conditions and they're reacting very differently to treatment and they need different things. So, you know, having that individualized time for each patient, talking about their specific care and their treatment and making goals, achieving goals for the specific patients is really important.
Oh, absolutely. That's the thing. I need to reach out to some of those people. I think it'd be good to have on the podcast later. You know, somebody from these different teams to kind of bring their perspective and talk about how they work with nurses and nurse practitioners and the services they provide for patients and stuff. Because I think we get tunnel vision, you know, from a nursing standpoint. This is what we do. We do everything for the patient, and that's simply not true, you know.
Yeah. Well, and you don't realize what all the other disciplines do until you have more interaction with them and stuff. Because, you know, when I worked at the bedside, I didn't have that same interaction with them that I have now. And I learn a lot from them every day, every time that I work.
Oh, yeah. Well, I've talked before about, like, you know, my pharmacy friends who I love to give a hard time. However, I've gotten spoiled because pharmacy comes during a code. And I don't have to think about what runs, what's compatible, you know. I don't have to, they'll even look at the labs for us and be like, hey, I suggest this, or, so I get spoiled because, you know, like, when I was at the bedside, particularly in the ER, I know a pharmacist, especially not on night shift.
Yeah.
And you're like, oh my God, they have so much knowledge. Oh, I love them.
Please don't ever leave me.
I know, yes, so much.
But I need you. Please stay.
Yes.
Don't go anywhere.
Oh my gosh, they're so good. No, and I'm sure, like, your dietitians are so good. I'm sure, I mean, and, like, your physical therapists and stuff. I mean, we don't traditionally probably think about your ICU patients getting PT and stuff, but they do.
They do, yeah.
I mean, you see, like, these amazing, I mean, you know, every now and then I see these amazing videos or pictures of somebody, like, who's, like, still on the vent or on ECMO or, God, whatever device we've made up next, you know, and they're, like, doing laps around the ICU.
Yeah, that always blows my mind because I feel like if somebody is well enough to walk, then maybe they don't need the vent, but then you don't think about the people that are difficult weans. It's like their legs aren't messed up. They can still walk. They just are having a hard time.
Recently I saw this, like, on a social media post, and I may have shared it on the Code Brew page, but this lady was, like, still tubed and walking around, and I feel like she had another device. I mean, she was walking around, she had a walker and stuff. Obviously, she had a lot of members of the team.
A lot of assistants. Yeah, I think I saw that.
a lot of people there supporting her, cheering her on at the same time, right? You know, but being very helpful. But I mean, that's amazing that we're able to get them moving and stuff. So, yeah. So I think it's important that we talk about the team and what all goes together it comes together to care for these patients. So.
Yeah.
Okay, so I mean, one of the primary things that I want to talk about having you here is that transition from being a seasoned bedside nurse to then being a novice nurse practitioner, right?
It's definitely a hard transition because you go from being a big fish in a little pond to being a little fish in a big pond. Yes. So, I switched facilities whenever I transitioned from being at the bedside to being a nurse practitioner. So I had to learn a whole new facility too.
Right.
But yeah, it's definitely a challenge, but you just have to kind of take everything in stride and know that, especially if you have bedside nursing experience, that you have a good foundation. You've had a foundation that's laid. Now you're just building the house. You're learning all of the different ins and outs and things like that.
I've heard that that same metaphor before. I like that you have the foundation. Now you got to build the house. Yeah.
Well, in school gives you a lot of the foundational work too, but whenever you move into clinical practice as a provider, school doesn't necessarily give you everything that you need. They can't, otherwise you'd be in school for forever.
Absolutely, yeah.
But so your previous experience and then your education really gives you a good foundation to build off of. I think mainly it's just having the confidence, which sometimes is hard, especially as a new provider. And when I started, I did have to work some nights, and I was by myself in house.
Yeah.
So I really struggled with imposter syndrome. Like,
I can see
there were a lot of nights where I was running codes or doing procedures, and I'm like, who said it was okay for me to be here?
Well, I joke about that as a house manager now, and I look around and I'm like, who's the adult? And I realize it's me.
Yeah.
Yeah. I mean, I feel like that's going to happen again. I mean, I had to confess, like, I've been struggling, being in school. I'm very confident in the job that I do, right? I feel like I know what the expectations are. I feel like I understand the goals and what we're trying to accomplish as an organization and what I'm supposed to provide for my patients, right? But stepping into the role as a student, and then thinking about things as a provider, I tell you, like, it's been very difficult for me. I'm having a lot of issues with confidence, and I'm like, who are you? Like, you've never had trouble with, I'm not say that. Like, I have had trouble with confidence in the past, but I'm usually almost even a little bit too cocky, I've been accused of. Imagine. But,
don't believe it at all.
No, but I am. I'm like this transition, and that's one of the reasons I wanted to have this conversation, because I know I can't be the only one.
No.
And it's super scary.
It is.
And so, like, going into clinical practice, I'm like, they're going to be relying on me to make decisions. Of course, I have a safety net because I'm still in the clinical role. But people are going to be relying on me to make decisions. And I've got a chart, as a provider instead of as a nurse.
I think the hardest thing for people to realize is, like, it. You just have to change the way that you think about it and how you act on it. Because, as a provider, you're the one giving the orders and making treatment plans and managing the care of the patient.
So I've been making suggestions up until now. And now I'm like, oh, there's no one I'm supposed to suggest it to. It's me. Yeah. Oh, God.
Yeah. I don't think there will ever be a role that you'll be in that you're the final stop. There will always be somebody that you can call and say, hey, I have this going on. I just wanted to pick your brain. I mean, there were a lot of times where when I was here at night, I would have someone that wasn't doing well, and I would do all of the things that I could think of, and they wouldn't be getting better. So I would call the fellow that was on. Oh, yeah. And I would say, hey, these are the things that I've done. What do you think? Give me your suggestions. What else can I do? And a lot of times they would have some good tips, or there were some times where they're like, oh man, you did it all.
Did it all, yeah.
So if things aren't turning around, then we maybe need to discuss what our goals are going to be. But, you know, there was always somebody that I could call.
That's a comfort. Being in the APRN role, you do have physicians as resources. I mean, I think what you're describing is like that, having those resources and knowing where those resources are, establishing relationships with people who can be those resources, and like that is very important.
Well, and knowing when to utilize those resources is also really important too, because you're not going to know everything.
No, never.
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 Well,
You'll
and that's
never
one of
get
the
there.
things about being in medicine is you're committing to being a lifelong learner. You always have to keep up on the new trends and treatments.
You have to.
You have to stay up to date on those
Because
things.
if you're not staying up to date, your patients are not going to get the best care.
Yeah.
Because we keep improving things, or we are attempting to improve things on a near constant basis.
Yes.
Oh, I really like that you're committing to being a lifelong learner. Anyway, so identity change. So you dealt with some imposter syndrome.
Yeah. I still suffer with imposter syndrome sometimes. I've been in this role for 6 years, and there are still some days where I'm like, I shouldn't be allowed to do this. I mean, even coming in here today to talk to you about advanced practice nursing, I'm like, why? How am I the one that's qualified to talk to somebody about
I can
this?
assure you you're more than qualified.
But sometimes I don't feel like that.
Yeah, I get that. But I know from the time that we've spent working together, and also the way I've seen you interact with others and stuff, you have an exceptional bedside manner. People go to you as a resource, and you're kind, you're approachable. Sometimes those are things you don't teach. Like, you have those things that you can't teach. Like, they're just a part of who you are.
Yeah, definitely.
So, that's one of the reasons why I wanted to have you on here, because you just, like, are the total package.
Gosh, thanks. I'm going to come on this podcast more often.
Yeah.
No, I always come at, like, I consider care in the vantage point of how I would want it to be for myself or my husband or
Very true.
my family. I would want their providers to be kind and informative
100%.
and have good bedside manner. But, you know, sometimes bedside manner only gets you so far, but like, you also need to have the intelligence to take care of the people. So, like, I try to make sure that families feel included in the plan, that I'm thinking about how they're feeling, because a hospitalization, you know, obviously is stressful for the patient, but their family on the other side of the bed, like, you have to treat them too, to an extent, you know, but there are sometimes that the family, you know, can sometimes be a little bit of a hindrance, but.
Well, these are complex situations.
Yeah. Well, and sometimes, you know, we'll have patients that, you know, the mom is the primary caregiver for, you know, their son or daughter because they have, you know, developmental disabilities and things like that. So they do a lot for them at home, and then they bring them to the hospital, and then we're doing everything. So they have a really hard time with that sometimes.
Adjusting to that role.
Yeah.
Yeah, letting go.
Yeah.
Well, and it's good. I mean, we try really hard to keep families involved.
Yeah.
As much as we absolutely can. And a lot of that goes back to, like, you know, we try to educate them on what we're seeing, because they frequently don't. They're not in these situations often. I mean, how often do you take care of somebody who has, you know, their family's an ICU nurse too? You know, because you wouldn't have to explain everything to them, but it just doesn't happen that often.
No, it doesn't.
So you're really having to educate along as you go. For every time you have discussions with the family, it's like, this is what I'm seeing, this is what this means, and you're you know, assessing people's educational needs, because, you know, you're trying to meet them where they are, because some people are at very different levels whenever you're having these discussions. And then family situations, like I said, can be quite complex. I mean, we've talked about that before, where you know, 3 girlfriends and a wife shows up, and then the mom, and you're like, ooh, this is
a lot.
It's a lot.
Yeah.
We love taking care of patients, but we do sometimes wish that you did not have such complex lives prior to your stay in the hospital.
Yeah. Well, and sometimes the social dynamic can get in the way of care.
Yeah.
But I'm not there to fix that. I can't do anything about that right now.
Right.
So please let me focus on your loved one, because I can't. The outside stuff is only going to delay or,
Yeah, if we're having to stop what we're doing, to separate family members and focus on those things, it is pretty challenging. So
yeah, it can be.
So, what about boundaries and burnout?
I think it's really easy to let your imposter syndrome drive you to trying to overperform.
Yes.
I think you feel like you need to prove yourself, so you take on all of these tasks and responsibilities because you feel like that's what's going to show people that you know what you're doing.
Yes.
And you take on too much too early. Absolutely. I mean, you'll definitely get burnt out for sure.
Yeah, it's become so easy to get burnout, and that's one of the things. You had recommended a whole episode on burnout, even when I was like first talking about the podcast.
Yeah, well, that's because that is essentially what drove me to want to go back to school. Now, I always wanted to have like a deeper knowledge base and have a higher level of like authority with managing patients and stuff. And I always want to learn and seek knowledge and all of that stuff. And I always knew that I wanted to go back to school, but I was getting burnt out. And then I got kicked in the chest by a delirious patient that had been in a house fire. So I didn't blame him at all. Like, he woke up after being at home and now he's in the hospital on the vent. So he was in a lot of distress. He kicked me. And at that point I was like, I can't do this forever. Yeah. Like, this is not me. Like, it kind of accelerated my timeline because I knew that I always wanted to go back. I just I hadn't started applying yet. So then I kind of applied, like, it was like a knee-jerk reaction. I kind of applied last minute, and
you're like, I gotta get out of here.
I gotta go.
I'm
this
gonna go
isn't
to
for me. So then because I kind of panic applied, I applied to part-time programs because I got my doctorate degree. And at the time I was single and living alone, and I owned a house, and I didn't have the time to think about, could I make it work going to school full time? So I was like, I need to still work full time. So part-time school is definitely that. So then it took 5 years.
Yeah. Well, this isn't my first time being in grad school. Of course, my grad school was affected by COVID, so I don't know if that was your experience or not. Were you pre-COVID?
I was pre-COVID. I graduated in 2018, so I was a nurse practitioner in the ICU during COVID, which is a whole...
That's a wild ride.
It was insane.
Wild ride, Mr. Toad. Okay. Yeah, no, I started pre-COVID in nurse practitioner school. And I got to the point where it was time for clinicals, and
no one was doing them.
But absolutely, nobody wanted to take on a student, And then it just became, it was very challenging. Then my son was born, so it was like, you know what, I gotta, rearrange some of my priorities, which I did, and now I've gone back. So yes, I might be on the long path as well, but
and that's okay.
Yes,
that's okay.
Yeah. Do you remember any of like specific lightning bolt moments whenever you were like, oh, I'm the provider?
Yeah, I mean, there's a ton. I've been doing this for 6 years. I do remember there was one time during COVID, there was a guy that came in, and for really no reason other than some like really vague findings on his skin, I kind of fell down a rabbit hole of thinking that he had vasculitis, and I ordered an expensive workup, and my attending was not pleased with me. I got a lot of messages regarding the things that I had ordered. And discussion. Why did I do that? And why did I think that? And then fast forward, I mean, he was in the ICU with us for a while. But toward the end of his stay in the ICU, we actually consulted derm, who did a biopsy and confirmed that he had vasculitis. And I was like, I knew it. I caught that from day one. I knew it. And it was just like, I know what I'm doing.
That's
like,
awesome.
this is it. Although, like I said, I mean, he had some really vague findings.
And it can be that way. I mean, how often do you actually see somebody whose symptoms like look like the book told you it was supposed to look?
Oh, never. And that's another thing too, is like school is really good about giving you a textbook clinical symptoms for every condition. And it's not always like that in real life.
I mean, I feel like it's hardly ever like that. You know, I mean, I think I feel like we get excited when we see somebody textbook because we're like, oh, this is how it's supposed to look. It's so easy.
Yeah.
It's like you hit the easy button, right? Mm-hmm. You know, and it's so rare that we get excited. I have to say props to you though, because I feel like derm is like the hardest thing. So
it's definitely not my thing.
If you put the derm stuff down, like that's pretty intense.
I will give a disclaimer that derm is not my thing. A lot of people have come to me like, so-and-so has this rash, and I'm like, nope, I'm not the person.
Oh my God.
But just somehow I was like, this guy has he has all these things going on. He has vasculitis. Wow. I'm going to jump down that rabbit hole. And I remember the PA that relieved me that came on that morning, I told her that I'd ordered this vasculitis workup, and she was like, why did you do that? I'm like, I just have a hunch. And she's like, okay.
Well, and you were right. Don't you just love that?
I was right. I do love being right. You should ask my husband.
So, well, yeah. I have one of those. I have that trait as well, we might say. So as far as NP school, like we know that they are getting us prepared to take boards, right? Mm-hmm. They're giving us a good foundation, the basis of knowledge. What do you feel like are some things that you wish you had known whenever you were in school?
I wish that I had a better understanding of billing when I was in school.
Because that seems super complex. I am very intimidated by that as well.
Yeah.
These codes.
It's really not, like, once you learn it. So that's why I think just like an intro to billing would have been really nice. Mm-hmm. But I remember there was a day that we were in class and a girl had mentioned like, hey, are you all going to teach us anything about billing? And the professor was like, we could spend a lot of time on that. And it's going to vary, like the different billing systems and things that you're going to use are going to vary between facilities. So like the codes are going to be the same, but you're going to learn them. Like once you get on the job, you're going to learn the codes that you're going to use all the time. So we're not going to spend any time on that. So I wish that I knew more.
You have us take a business class now.
That's good. I'm glad because
I think it's called like the business of healthcare, and you have to like talk about, it's billing codes, and then also
like RVUs and stuff like that.
Yes.
So they didn't teach a lot of that when I was going through, mm-hmm. and then I kind of really struggled with billing. One of my attendings would text me in the afternoon and be like, hey, you need to fix X, Y, and Z because you're doing this wrong. Oh. And I got that message from him quite a bit. So then I was like, can you have somebody from billing come and talk to me? Because I don't understand what I'm not understanding about this. I have very limited knowledge. I didn't learn this. So, I sought out an expert to teach me the things that I didn't know. And I think that that's an important token to take away too, is you're not going to know everything. So lean on your resources mm-hmm. and keep reaching out for more information if you don't understand something, because you're not always going to know the right answers.
Well, I feel the same way. I mean, of course, in the ER, because of EMTALA, you can't even ask about billing, right? So like, it's like a taboo. You don't do it. Like, we don't talk about it. I don't know how much anything costs. And I used to joke that I was happy about that. I don't know anything about money. I'm just here to take care of you. And then I think in general, working as a nurse, like that's kind of how you feel. I don't know anything about billing. I don't know how much this medicine costs. I don't know how much this IV costs.
I mean, at the end of the day, none of that stuff really matters.
It doesn't. It doesn't. So it's all done for us. So then you go into the NP role and you're like, oh, I probably should know about this. But you're right. I mean, it's very intimidating. I definitely share it, like, but I do think, I haven't taken it yet. I think it's like one of the last classes I take. Mm-hmm. I think there is one about billing. But I feel like right now, they do have us, like in some of my assignments, like submitting ICD-10 codes. And like,
Which is great to familiarize yourself.
There's like 15 for each thing.
There's a lot.
I mean, it's like a maze.
Mm-hmm.
Like, you just never really know. Like, it's like one of those mazes where you like walk in and there's 52 mirrors around you and they all look the same. They look like you. And you're like, which one's me? You know?
Yeah. Which way do I go?
It's very strange. But yeah, no, anything else that you feel like maybe could have helped you in school? Like, if you learned it in school? I mean, it's probably pretty subjective. Like, you just like come through, like you navigate.
Yeah, well, and it's been so long since I was in school.
That's true.
Well, I mean, 6 years. It's not really that long, but I also
in nursing years.
I feel like I've lived 1,000 lives since I got out of school. And then, you throw a pandemic in there.
Yes. I'm about to say.
You throw a global pandemic in there, which itself felt like a decade.
I mean, that COVID years are literally like dog years. Like, you're like, I lived 7 years and then another 7 years and then, yes.
Yeah.
Yes. My mom was giving me a hard time, about the wrinkles on my forehead. Listen, girl, okay. She told me I had wrinkles on my forehead. I mean, I am 37, but she gave me this new face wash, and I'm thinking, what put this here? Well, I have a kid now, but also, it might have been COVID.
Yeah. Yeah, definitely. It was very stressful.
What helpful resources do you find as an APRN as far as like tangible resources, like apps? Is there like certain websites you like to use?
I use Up to Date a lot, and I think that's primarily because it's built into our charting system.
Yes,
so I have easy access to it. But then also it's really nice because you can create your own profile, and then as you go in and look up things in it, you get CME credits for it.
Oh yeah,
so you get time for the things that you're learning on the job, which is great because then you can go back and pull all of your time and then submit that when it's time to prove that you're learning things.
That's pretty cool. I knew that you could do that. I've just started using Up to Date. I previously, I guess, fell down the rabbit hole the hard way. Mm-hmm. And now I have Up to Date, and I'm like, oh, I can get lost in here for a long time.
Yeah, well, and Up to Date is so nice because everything is so clear and concise in there. Yes. It's really easy to navigate. Not that any of the other apps and things aren't as easy, but I mean, literally everything is in there.
Oh, yeah.
It's kind of like a one-stop shop. And then I rely heavily on other resources like my people. So like my pharmacist and the other providers around me. Like before I started in this role, I didn't really have much exposure to physician's assistants, but I work with several of them now, and their training is so robust, and they know they have so much knowledge. I think I've learned more from the PAs that I've worked with than anything.
Well, it's such a different perspective. Like, they don't come from a nursing, so they don't use the same models of education. They're not using the nursing models. They're coming from more of a physician perspective. Mm-hmm. So I've heard very good things about their education. Yeah.
Yeah. I rely very heavily on several of my PA friends. So
you've I'm sure identified mentors.
Oh yeah. Oh my gosh. Having a mentor is so invaluable. Mm-hmm. Just having someone that you can bounce ideas off of or talk to and say, hey, this is the scenario that I had, what are your thoughts on it? What would you have done differently? I can't speak to that enough. And I think that it's important to have a mentor in any nursing role that you have. Starting out as a new grad nurse, find a mentor. And some hospitals give you a mentor, which is great. Right. That is so good.
A more structured program.
Yeah. Having that is a great resource.
We've talked about that many times on the podcast, like how important that is. It cannot be overstated how important a mentor is. And we're talking about someone who's going from, today on our podcast, we're talking about someone who's going from an experienced RN role to an APRN role. Anytime you are changing speeds and, basically going back into that novice role, even if it's a transition from a med surge to an ICU or a transition from ER to cath lab or whatever it may be. You're becoming, in some instance, a novice again. It's so important to identify a mentor or mentors that can help you navigate that transition. I think that's really important.
Yeah.
But I'm sure you've been a mentor for a lot of young NPs now.
I think I have.
Yeah, it's awesome building their legacy. I think about that sometimes, like how proud I am of the people that I've helped grow as nurses throughout my career. I'm sure you're having the same experience.
Oh yeah, it's always good to see the people that have gone through clinical rotations with me, and then seeing them in their roles as advanced practice nurses, or having them reach out to me and saying, "Hey, I'm going to apply for this role. Will you be a recommendation or a reference?" And
you feel honored.
I do. Every single time. I
so feel honored. Literally on the way here, it was a recommendation. Got a call to be a recommendation for a colleague and friend. And I was like, oh my God, they put me down. I was like, oh my God, they're amazing. They're the most wonderful nurse. You take those things very seriously.
Oh, definitely. There have been so many times where nurses come to me and they're like, I'm applying for, NP school or CRNA school or, what have you. And they ask me for a letter of recommendation. And I'm always so happy to give them one. And then I joke and I'm like, listen, you're not going to be the one that ruins my streak. Everybody that I've written a letter of recommendation for gets in.
You better take this seriously.
So don't be messing around because you're not going to ruin my streak.
So what you're saying is your name carries weight.
I think so.
We should throw it around.
I think people know.
I'm going to throw it around. Phylaxis.
All the way.
So you are, and we don't have to dive super deep into this, but you're transitioning into a new role
right now. Yeah, I'm in the middle of a transition. I'm going to be moving over to a role with the neurosurgery team. So I'm going to be kind of taking my own advice, I think, because I'm in a way going to be going back to a more novice role. Yeah. Because I've taken care of neurosurgery patients, so I have a broad knowledge of that, but I've not done it as an advanced practice nurse, so I'm really excited for the change. And, like I said earlier, I'm always trying to seek ways to learn and grow, and this is just another step in my career and my progression. And I'm fortunate that I know some of the nurse practitioners that are already working with that group. So it's not like I'm new. There are some familiar faces, but there are some of their NPs that I've looked up to for a long time. That's amazing. They are experts at what they do. Like when I was a nurse at the bedside, one in particular, I was like, I want to be like her when I grow up. And now I'm going to work with her. So it's kind of, I don't know, serendipitous, if you will.
Well, that's super cool. That by itself can give you some confidence because you're learning from people who are so competent.
Yeah.
It feels so good. I remember, I've had that experience along the way with leaders and that kind of thing. But I remember whenever I really was like trying to decide what I was going to do with my life. I started working in the ER as a tech. And I really didn't know what I wanted to be when I grew up. But, most days I still don't. And I really don't want to ever grow up, if you want me to be honest. But anyway, it was some astounding, amazing, truly inspiring nurses that worked in the ED where I was who inspired me to be a nurse. And I still think about them. They've done wonderful things. And they were, to me, they were just like on this pedestal, just like amazing badasses who knew everything. And, some of them went on, were flight nurses. Some of them, went on to be educators. Some were charge nurses. Some, they've done various amazing things, but I was so fortunate to learn from some people like that. And it made me so confident that I knew I was learning from amazing people.
Yeah. It really makes a difference.
All I have to do is listen and do what they tell me to do. And I'm going to be good too.
Well, and then it's so good because you have those people that you can ask questions to.
100%.
And feel safe in asking questions with them, and knowing that they're going to give you good information and good feedback and those types of things. I always say, like, the people that I'm terrified of the most in any role are the people that don't ask questions.
Oh gosh,
The
we
people
talk about that on the podcast.
The people that just come in and just do the thing and they don't ask. Like,
Oh, yeah.
I've never been the type of person that's been afraid to ask questions. Like, if I don't know something, I'm gonna say, listen, I don't know, but I'm gonna figure it out, and I'm gonna ask questions. I've never had a problem with it. So
No, 100%.
if I don't know something, I'm phoning a friend. I'm finding a resource. I'm doing something. I'm going to figure it out.
We talk about that. I mean, Luke and I have talked about that so many times about, like, number one, if you're in a culture where you feel like you can't ask questions, you need to run away.
Yes. Run for the hills.
So fast. And then the other being, like, if you meet someone and they're not asking questions because they feel like they know everything, then you can just label them as a 007, right? Because they're going to kill somebody. I mean, it's just that, it's really that black and white to me. Like, if you're not asking questions constantly,
you're scared.
You are scary.
You're scary,
You
Larry.
are so scary. Yeah. So tell me, like, the role of self-care in being an NP, particularly critical care, I'm sure.
Yeah. I mean, it's really important. Like, the job itself is so stressful that you need to have ways to decompress. You need to have time for yourself. So, there are some times where I have a day off and my husband says, oh, I'm going to take the day off and work from home too. And I'm like, no, I need this time to myself.
Mm-hmm.
Like, I love
But
you.
he's so great.
He is good. He's great. He's the best. But I need time. And there are some days where, the last shifts that I've worked are so heavy that all I want to do is just work on a puzzle all day because I'm a 90-year-old grandma.
No. I love puzzles.
Do you like puzzles too?
I do.
I didn't know that.
I do.
Oh my gosh.
100% jigsaw puzzles. It's something my family likes to do, actually. So we, I kind of got it from my parents, and I still do puzzles. I have some at the house right now.
I'll have to show you a picture of how many I have. It's kind of embarrassing. Not really, because I love them so much. But
see, my problem is like, I do a puzzle and I don't want to put it back in the box. Like, I want to frame it. It's amazing. It's this feat. It's this accomplishment. But then there's not enough wall space. So what am I going to do?
One of my best friend, actually, I was going to say one of my best friends, but my best friend puts puzzles together and she always glues them and hangs them up. And I'm like, I would run out of space.
Oh, 100%.
On my walls.
Like, just what I have in my house right now, I would run out of space.
Yeah. But and it's funny because, like, she glues all of them and hangs them up, and then I'm the person, and this is probably going to change the way that you think about me.
No.
As soon as I get done with them, I break it up and put it back in the box.
No.
I do.
I have to celebrate.
Yeah. Well, I take a picture of it. I have a whole folder on my phone of puzzles that I've completed, but as soon as and I think part of it is, like, I'm excited to start the next one. Like, I need to clear my space. We have a guest room in our house that I have a desk with a puzzle board on it, and I have a bookshelf with puzzles on it, and that's my room. That's my puzzle.
See, I have, like, puzzle hangover. Like, I'm real sad when I finish it because I'm like, oh, this is over. I mean, I'm excited because I finished it and it's amazing. But I'm also, like, sad. It's like whenever you, like, read a book too fast and then it's over and you're like, oh my God, I have to wait 2 more years to, like, write another one. And you're like, yeah, it's like that.
See, I don't know how that feels just because I'm so
excited.
Because
you're like, I gotta start the next one.
Yeah. Well,
I say, like, that's how I feel about Legos, though.
Oh.
With Legos, I'm like, oh my God, look how cool this is. Let's do another.
But they're so expensive.
Girl, I know.
They're so
But
expensive.
I love Legos.
But, like, so I'm part of a puzzle exchange group. So we meet, like...
You are. I love it.
Every 3 months and swap puzzles because, I mean, you don't want to spend...
Yeah.
$20, $30 on a new puzzle every time you get a new.
Oh, that's brilliant.
I don't make that much money. Like, I get paid decently, but I don't make that much money.
Right.
So I go to these puzzle
at the rate you're probably going through.
Yeah. No. I mean, I would be broke.
Yeah.
So we go to these puzzle swaps and then I come home with like 16 more puzzles. And
oh my God, I love it.
Yeah. It's great. Awesome. I'll have to send you the link to the group so that you can
That'd be super
participate. Fun. It is a lot of fun. But no, going back to that, self-care is very important because it's easy. Like I said earlier, like, it's easy to overburden yourself
Yes.
with stuff because
Just
you're
keep
trying
saying
to prove
yes.
your point,
Yeah.
or you're trying to say like I'm supposed to be here, and I'm trying to overcome this imposter syndrome, and you take on too much. And
Yes.
so self-care is very important, and setting boundaries, and just
Luke and I both have that problem. We're not very good at saying no.
I'm not either, and it drives my husband crazy. Like we donate money every month to Heifer International to give people in other countries animals so that they can learn to sustain things and take care of their families and stuff. So like they get a chicken and then they can sell the eggs and all of that stuff. So
That's awesome.
I'm not one to say no. So it is hard sometimes for me to establish boundaries, but I'm constantly learning how to be better about that.
Yeah, it is I think it's going to be a lifelong thing for me, is like just remembering that it's okay to take time for myself. But I don't want people to be like me. I want to like encourage people, through the podcast to like listen, take time for self-care, whatever that means for you. For me, it means sitting on the porch or doing a puzzle or Legos
or running. You like to run now.
Yes, I love
you
to
love
run.
to run.
Yes. I've started lifting weights too. Honestly, self-care can mean so many different things.
Yeah, it's different for everybody.
Going to my son's T-ball game, he just started T-ball. Going to his T-ball game is
I bet that's so
self-care.
cute.
I love it. It's adorable and also hilarious. But like that is something like it's a very positive experience. It is filling my cup.
Mm-hmm.
You know what I mean? So like, that's self-care.
Well, it's important to also remember that you can't pour from an empty cup. So if you're not
100%.
filling your own cup,
Yes.
you can't help others. It's
true.
been very hard for me to realize that and to practice that, because I'm the type of person that if I can do something for someone else, I mean, I will
Then
stop
do
at
it.
nothing
Yeah.
to do it.
Let's do it.
And even sometimes it's at my own expense. And
can be.
it's taken me a lot of time to, get to the point where I'm like, okay, no, I can't take on all of these things because I need to take care of me.
100%. No, I totally agree. No, I think I cannot agree with you more. That's a conversation we needed to have for sure. But I love that you do puzzles. So I'm super excited. We're going to talk about this offline. So let's talk about your tips for new grads and students. You've got several points you wanted to make, so I was really excited. Talk to me about what your tips are for new grads and students.
So the best advice that I can give people as a student and as a new nurse practitioner is just be patient with yourself and believe in yourself. Like you went through school, you passed your boards, you landed this job, you know what you're doing.
Yeah.
Just be confident. And if you don't know something, ask.
100%.
Like it's that easy. And it's so hard to do that when you're in the moment, but just always keep in the back of your mind, like, I can do this. Like I made it this far. I'm here for a reason.
Like you passed your boards, they did not give you the license by mistake. Like you're not the one person that just like
Slipped through the cracks somehow.
Yeah, no, like that's not how it works. Like you have established your competence, and once you get to that point, like they have bestowed this license on you because you have proven yourself worthy.
Yeah.
Right. So
just believe in yourself.
Absolutely.
And then of course, I mean, we talked about it, finding a mentor. We could probably cover a whole episode on the importance of a mentor, but I think we talked about that pretty thoroughly.
Yeah.
Set your boundaries early.
Mm-hmm.
Like don't take on too much stuff.
Mm-hmm.
If there's a resident that's always coming in late, not ready for report or whatever, and they try to call you once your shift is over, tell them, hey,
I'm out.
My shift is over. Your shift starts at this time. That's on you to make it there. Of course, I'm going to tell them about what's going on with the patients, because ultimately the patients come first. Like I want my patients to have good outcomes and good care.
But you have to set the expectation.
You have to set that expectation, and you have to do it early, because if you let people do those things, they're gonna take advantage of it.
Bust right through those boundaries. Yeah.
They're just gonna knock them down like the Kool-Aid man.
Yeah.
And then I think for acute care specifically, build a relationship with the other members of the interdisciplinary team. Build relationships with the pharmacists and the dietitians. And I rely so heavily on my pharmacists. Like I could never thank them enough for all of the stuff that they do for me. And actually they recently created a role for a second shift pharmacist. So basically my whole shift, there is a pharmacist that's dedicated to the ICUs that's rounding with us. And I mean, they've saved me several times with finding culture results toward the end of the shift when I've already checked on it 3-4 times and nothing has come back. And then they call me and say, hey, it popped positive for this. Let's change these antibiotics. And that's just giving better care to our patients. So I can't shout out to our pharmacists enough.
About the time they got that second shift pharmacist is when I started getting really spoiled.
Yeah. Oh, no, I was. So I'm really hoping that the facility that I'm transferring over to has a second shift pharmacist, because if not, then I made a mistake.
Oh, well, you can always come back.
Yeah, I'm sure they'd take that.
Absolutely.
And then in that same vein, learn from everyone. Like, everybody brings something different to the table. And like we were talking about earlier, how the training for PAs is so different.
Right. They have a really unique perspective.
Yeah.
Because it's different from us.
Yeah. And you can learn from the attendings that you're working with, or fellows or residents. And just remember, you don't know it all, and be open to learning from people, because, you know, there are different ways to do things. So just learn them. Find what works for you, but learn from everybody. And then prioritize your self-care. I can't stress that enough. Like I said earlier, you can't fill from an empty cup. You have to take care of yourself in order to take care of others. That's hard to realize sometimes, you know, especially working in a critical care role. I spend so much time making such big decisions all day when I'm at work. And then I come home and I don't want to make big decisions. I don't want to make any decisions. I come home and my husband says, what do you want for dinner? And I say, I don't care, because I genuinely don't care.
I have those same moments.
And I don't want to think about it.
No, I mean, whenever you basically have to make life or death decisions, or just decisions that are, you know, even profound, you know, have profound change for your institution or whatever it is, these heavy things we have to do in healthcare. Sometimes when you leave work, everything seems so trivial.
Yes.
Yes. And it can be hard to be mentally engaged.
Yeah. Definitely. Sometimes I just want to switch it off.
Yeah, no, totally the same. Listen, thank you so much for coming on the show.
Of course. Thanks for having me. I'm really excited.
Yeah, I can't wait for everybody else to hear this, and you know, and I'll think of a reason to have you back on.
I'd love to come back on. We'll talk about anything.
Yeah. Well, there's the sky's the limit, right?
So many things we can talk
topics.
about.
Yeah. Before we go, I do have to rep our merch store. There's coffee, there's hoodies, there's probably some chaos over there at cobrewpodcast.myshopify.com. Always for your first order, Brew Crew 10 for 10% off. That's your coupon code. We're still very excited to learn about coupon codes, you know?
Yeah.
Because that took me some time to figure out.
Oh, I didn't know that.
Yeah. I'm learning though. So, like I said, thank you so much for being on and sharing your wisdom and being honest with us. And, yeah. So, stay caffeinated, stay curious, and we'll see you next time on Co Brew.